Okay, all right, I think we'll get started this morning then. So, hello and welcome to UCL Global Business School for Health, MSc Digital Health and Entrepreneurship Taster Lecture. My name's Laura and I'm part of the Marketing Communications team for the Global Business School for Health. Today's lecture will give you a taste of what to expect if you choose to study a Master's in Digital Health and Entrepreneurship and help you gain insight into what it's really like to study on the programme. The session is being recorded and will be shared with you via email following today's session. Now to introduce our speaker, delighted to welcome Dr. Clara Aranda, Associate Professor and Programme Lead for Digital Health and Entrepreneurship at UCL's Global Business School for Health, who will be giving today's lecture. Following that, there will be a Q&A session. So there's a Q&A button at the bottom of your Zoom screen. You can type questions in throughout Clara's presentation or after, and we can address them at the end of the session. And with that, I'm going to hand over for the lecture. So over to you, Clara.
Thanks, Lauren. Hi, everyone. Good morning, good afternoon, or perhaps good evening for some of you. Today we are gonna, I'm not sure, I can see some of the attendees that I think were in the previous taster session. Today, the session will be slightly different, and I'll explain, a little bit more about why. So when we think about our MSc, always say, the details in the title of the master's itself. So we have digital health and we have entrepreneurship. While we cover, both, through our different modules, we have some of the modules in which you focus quite a lot on digital health and the application side to digital health, as we did, in the previous taster session that focused on human factors and digital health specifically. Now, when we think about the entrepreneurship side, entrepreneurship is about a mindset. It's about learning tools, learning different frameworks. These frameworks and these tools are not necessarily or haven't specifically been developed for digital health, particularly startups as such. But what we do is we learn from all of these existing tools, so these existing entrepreneurship, skills and frameworks and tools, and we apply them to the digital health sector. So we bring them and we introduce them for us to think about how we can identify problems in the healthcare sector, how can we define, solutions, and how can we identify an opportunity to generate value. And it's not just financial value, but also value to our customers or our users or beneficiaries or whoever needs that solution. So how do we define value for them? But again, all of it within the context of digital health. In my case, I teach most of the entrepreneurship side of our program. It's a little bit because of the background that I have and the experience that I bring into the program. So the modules where once you join the program, the modules in which we will interact, they will be digital health startups, a little bit in entrepreneurial finance module, and quite heavily on the business project. So the business project cuts across all of our MSCs, and I work with all of you, our digital health students, but also global healthcare management and biotech and pharma on the business project. For both the digital health startups and the business project, you need to come up with an idea on, an idea that you can develop and convert into potentially a business. So you need to build a business case for that idea. Each module is slightly different and focuses on different things. At the beginning of the module, particularly for the business project, we focus quite a lot on the ideation process. How do you identify a problem? There are so many problems out there, in the health sector. So how do you pick a problem? And then how you're going to spend so many months, working on that idea. So how do you evolve from the problem space? How do you move from the problem space to the solution space? Yeah. So the lecture today, this tester session, is an adapted version of one of these sessions. So as you can imagine, my entrepreneurship sessions tend to have a hands-on component. I adapted it a little bit, so hopefully it works. But I will take you through the lecture. Again, it's one of these sessions that we have for the business project. So I'll take you through the lecture, and hopefully we get through the chat, we get to interact a little bit, either the chat or the Q&A or the Q&A box. We get to interact a little bit and think about, the problem space for this particular session. In the real lecture, so once you join and you have the lecture, you will be working with your group. So this is a session in which you work with your group and you discuss ideas and all that. So it's a lot more interactive and dynamic. Right, so let me start. I gave you a long introductions just to contextualize the session today. The first thing to remember is that when we start an idea and we try to push a business forward, our chances to succeed are very slim. So it is estimated that about 75 to 90% of startups will fail. There are a number of reasons, loads and loads and loads of reasons why startups might fail. And just to show you some reasons, this comes from a study conducted by CB Insights, in which they did a postmortem, they call it postmortem analysis. So they went back to analyze the startups that had failed. And they spoke with the founders, and they tried to learn about all of the reasons why their startup had failed. Now, I want us to focus on a few of them, the top ones. So the first reason why they failed is because they ran out of money. So sometimes for us to bring an idea forward and push it forward, it takes quite a lot of time. And when it comes to the health sector, not just digital health, when it comes to health technologies, medtech, digital health, it might even take much longer than what we expect because of all of the different processes involved in trying to get the technology into the market. And this is something that you will learn in the program. It can be a regulatory side, regulatory component that might take much longer than what you initially thought. Or it could be, this is a sector that is very risk averse. And the reason why it's very risk averse is because at the end, at the end of the day, if your technology or your solution goes wrong, the impact can be quite severe. It could cost, it could make people sick, it could injure people, it could potentially, be a cause of death. So for us to ensure that technologies, health technologies, medtech or digital health are safe, we need to ensure that we have conducted trials and tests and evaluate and ensure that our technologies are safe. So sometimes all of these components make that, what happened is that they impact on the type and the amount of time that it takes to bring our technology into the market. So often startups run out of cash during that process. And the second, which is the focus of the session today primarily, is that there is no market need. So startups went all the way. They spent the money, got together, built the teams, set up their companies, probably established their office, and set up, whatever in central London. And then they try to bring their technology into the market and nobody buys it, right? So there is no product market fit. There is no need for their technologies. So when we try to identify an area where we want to find or develop a solution, something that is quite important for us to remember is that going from an idea or even from experiencing or identifying a problem to actually having a business set up is not a linear process. It's a process that has different loops and different iterations. For us to visualize it and have a little bit of a better mental structure or a framework that can help us understand the process of designing a business, there are multiple tools that we can use for that one. I'll introduce you very, very briefly to the business, business design and testing framework that is used by Strategizer. Strategizer is a company that was set up as part of, I don't know if you're familiar with the business model canvas. I'm going to introduce it in a second, but they were academics from MIT who came up with the concept of a bit of, from the research. They come up with with the idea of the business model canvas, and as part of the work, they have evolved and they have generated many more tools that are actually quite widely used across businesses, strategists, accelerators, incubators. They use all of these different tools. Now, the reason why I like this visualization is because it gives us a little bit of an idea on how just the concept or the idea behind a business evolved. So we start with, with the top section, which is designing the business itself, coming up with an idea, prototype the business, assessing it. And then we move to the actual prototype of our product or our solution. So once we conceive it and we came up with a concept, we move to generating hypotheses about how that product is going to work, how the market is going to take it, how the business is going to operate. And we test and we learn and we iterate and we improve what we're doing. What this means is that, again, going back to the first reason why startups fail, is that all of these processes might take time. So we need to be conscious about, we need to plan ahead and have a little bit of clarity of all of the different things that we need to do in order for us to be able to launch our product or our service into the market. Yeah. So there are different names that this has, and when we are in the digital health startup module, we learn about the route to market or strategy to market. Yeah, so you need to have clarity on, in the next 2, 3, 5 years, I need to go through all of these different stages in the development of my concept or the development of my idea, of my business idea. And I will need this amount of time for me to prototype, test, validate, and be able to launch it to the market. There is a tool that it's widely used, which is the business model canvas, and it's basically a template that you can use to evaluate the different possible components that you need to consider when designing your business. We have the customer segments, identifying who your customers are, who are you targeting. We have the value proposition. We have customer relationships. How are you going to reach your customers? The channels, how is your product? So that's the method, right? So that's the method. How are you going to be in shops? Are you going to have digital platforms, digital shops? How are you going to have that interaction for the purchasing of your product or your service? Then we have your key activities. What is it exactly that you're providing and how are you going to provide them? So it includes the operations side of your business. What resources do you need? That would be key resources. What partnerships do you need to build? Imagine that you need a manufacturing company. Imagine that you need a distributor. Imagine that you need a partner for selling. So you see how there are shops that might sell, for instance, Garmin may have their own shops, but they can also sell at Cotswolds or Go Outdoors or all of these. So all of these are partnerships that are behind their business model, business model from a company like Garmin. Your cost structure, how are you breaking down your cost? How are you pricing your products and your different revenue streams? Yeah. We'll go in different sessions, we'll go through the details of that. So I will not focus much more on these for the purpose of this session. What we use this framework or this tool for is to help us make decisions. So when we are designing our business or we're thinking about the business, business that we want to design, we start with an idea, we prototype it, we assess the idea, and then we look at our business model that we initially thought, how we initially thought it was going to look like, and we say, right, does this stand? Is this valid? So for instance, is a digital channel the best way in which I can reach my customers? Maybe you did interviews, maybe you did surveys, maybe you spoke to people, and maybe people said, imagine that you have a target market for elderly people, you have a solution for elderly people. Maybe somebody will come and say, you know what, digital markets are still not there for people over the age of 60. So all of this is what you learn in the process of going around ideating, prototyping, and assessing. Yeah. So then you look back to your business model canvas and you reassess and you evaluate and you change it. So it is a tool that can be used multiple times as you progress in the development of your concept, in the development of your business idea. But you need to start somewhere. And that is that you always need to start with an idea itself. The first thing that you need to do is an idea. Now, what entrepreneurship is not about is starting with the solution. So we didn't come here to start with a solution. Sometimes I get students that come and say, for the business project, for instance, I get students that come and say, I have an idea. I want to create an AI tool to help people. Hold on, but what's the problem that you're trying to solve? You're coming here with a solution without knowing exactly what the problem is that you're trying to address. Why don't we start with a problem? So when we think about entrepreneurship itself, us as entrepreneurs, what we're really, really trying to do is that we're trying to provide valuable benefits to our user to solve a problem. And it can be an urgent problem, it can be an important problem, it can be a painful problem. It could be something that our users or our customers have to do once and once and once and once again. And they're like, I am fed up. I am tired of doing this. I need a solution to this problem. Yeah. So there are different types of problems that we can try to resolve. But maybe you say, well, okay, there are so many challenges. I have experience as a physiotherapist, they have experience as a medical doctor or as an oncologist, and I can see there are problems. In every step I take, there are problems. So how do you know what is a good idea? What idea shall I follow? Specifically, as I said, this part of the business project. So specifically for the business project, what is the idea that I should follow? What I want you to rephrase, or what I want you to rephrase a little bit and think, how do we know that our idea is a good idea? How do we know that we are choosing a problem that is worth solving? So like I said, there are problems everywhere. There are problems in, even how I hold this water, this bottle of water. There might be problems of that at the end. We have different experiences. We have different backgrounds. So there are problems are out there, but not all of the problems are worth resolving. Some of them are just they might need a change of behavior or something, but there are problems that are more significant than others. And of course, we're focusing on something that is quite important, which is the generation or the creation of value, and not just financial value, but there's also social value. So how do we define, or how do I identify the problems that are worth solving? The first one is that there are some problems that are urgent. They need to be resolved. Let's think about, the waiting times and the NHS to access a GP appointment, right? That is urgent. The problem is here. It's pressurizing our health systems, pressurizing the NHS. We need a solution. We need it now, because the implications or the impact of not finding a solution are much bigger. Yeah. The second might be impact. So I mentioned a couple of times, I think, already about the generation of value. So sometimes we don't focus necessarily on the creation of financial value itself, but we might be interested in thinking about the social impact. So let's have another example. In some parts of the world, maternal mortality is still very, very, very high. Now, that can be urgent, right? But it can also have a big impact. If we find a solution to that, the impact to society, positive, or the benefits to society will be large. Yeah. Sometimes solutions are needed, or solutions to problems are needed because there is no existing solution to that problem. Or maybe there is a solution that is not adequate. It might be too expensive. It might not be suitable. So it really is inadequate for that particular context of use. And I mentioned that very, very specifically for that specific context of use. So it might be that a solution works in one sector that might be applicable to another sector, or it might be that adaptation of existing solutions might help us apply them to a different sector. Yeah. Sometimes problems are boring, but nobody wants to spend time on them, or not a lot of people want to find solutions for them. For instance, you probably are familiar, you probably all have used Excel at different stages in their life or their work, or of your works or your academic journeys. And there are a few things that are quite boring, like creating a database. inputting things line by line by line by line. Well, there are multiple solutions out there that have been developed in order to help people with these type of tasks that are tedious, that are boring. Yeah. And finally, there is a growing market, or there's a growing need with a particular area of this problem that we're trying to resolve. Yeah. We can think about, for instance, I don't have one handy on the top of my head at the moment, but we can think, for instance, about an increase in the number of AI tools in the health sector. That's amazing. I think this year, from one report from CB Insights, I believe 60% of digital health startups have used an AI component as part of their technology. But that comes with another problem, right? We need technologies or solutions for interoperability, for instance. We need technologies or solutions to ensure AI safety in the market or in the sector. So as something is growing, we also need to identify other solutions to the emerging problems that come with that growing area, or sector, as the example that I have just provided to you. Sometimes, we find phrases about, what famous people say, and it's very hard to say, yes, definitely they said it. But supposedly, Albert Einstein said that if I had an hour to solve a problem, I would spend 55 minutes thinking about the problem and 5 minutes thinking about the solutions. That is because if we don't really, 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 really understand the problem that we're trying to resolve, the solution that we come up with at the end may be completely unusable, or maybe completely misaligned to the problem that we're trying to resolve. Now, occasionally that's not a bad idea, because you may find a solution that resolves a problem, but it is not necessarily the initial problem that you started with. So then it's a matter of you to decide as an entrepreneur whether you want to pursue that solution for a new problem, or whether you need to go back and fully and truly understand your initial problem. Go back and analyze it again, and reflect on it again, and break it in parts again, and try to understand all of the components of that problem to generate a new solution. And that's why when we think about the business model, again, going back to business model canvas, we need to ensure that it's rooted on the needs from our potential customers, or on the needs from our potential user. Yeah. There are different concepts that you will learn, as part of the program and in different modules, but we take you in the digital health startups, we take you through the concept of jobs to be done. So we do exercises like these, but converting a problem into a customer oriented problem from the perspective of jobs to be done. So we will learn that in a different module. But for now, for the purpose of this session, when we think about business model, we need to focus on the customer needs. And that is why when we work in the business model canvas, the very first step that we do is we think about our customer segment. Who are our customers? And then we go to the value proposition and we say, what's the value that we are offering to these customers? Yeah. What is it that I'm really trying to deliver for these customers? Yeah. What is the problem that for this specific customer segment I am trying to resolve? So when we think about the concept generation process, we need to always start with the understanding of the problem. And normally what we do is we draft a problem statement, but that problem statement needs to be drafted from the point of view of our users. We can use different approaches. We can use different methodologies for the purpose of this specific project. We use this problem statement framework, and we start by thinking about who. Who is your central customer? And we start with a sentence, I am a, then what? So what is the outcome that they are trying to achieve? And again, I mentioned the jobs to be done framework before. So what is it that they are trying to achieve, that they are challenging, that they're facing challenges to achieve? So I am a who is trying to. Then we talk about the barriers that they face to achieve that outcome. So what are the barriers that stand in their way of achieving the outcome? So we go, I am who's trying, but and then cause, what is the root cause of the problem? This is an important question which students often get stuck in it because they really struggle to think about, how to break down a problem and identify, do a root cause analysis, we call it. So do really root cause analysis and understand the bottom of the problem, what is really, really causing this problem. And the final, what is the impact, the negative impact of of not achieving that or not being able to deliver that. And all of this needs to be done from the perspective of the customer. Now, this is a framework. You can use it. You can use tomorrow. You can use it now. You can use it for any sector. We can use it for vehicles, solar power, whatever. In the health sector, we have a challenge, and that is that our target user might be completely different to our buyer. And occasionally, our user might be different to the beneficiary, might be different to the paying customer. So when we're thinking about the problem statement of a digital health solution or any health tech solution, we need to think about them from the perspective of at least these three groups. The user, because they probably will be the ones using the technology or the product itself to do a task. The beneficiary, because the technology might be being used on them. So they might be being scanned, they might be, they might be getting pictures of something. And the paying customers, because often the user is not the paying customer in the health sector. So it might be that the paying customer is a hospital, or it's a healthcare trust, or it's the Ministry of Health, or it's someone else, that it's not necessarily the clinician or the nurse or the individual that is going to use the technology. Just to give you a quick example, there is a startup in the UK called See the Signs. See the Signs has been running for over 9 years, and they built an AI-powered app to help doctors to detect early signs of cancer, very early stage, cancer at really, really early stage. And their success rates have been really, 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 really high. So it has been adopted by several hospitals in the NHS, several practitioners are using it. What is interesting is that it started, this is a very old article from 2018, and they were already talking about, AI in, for image detection and AI in digital health. There was an article just only 10 months ago at The Guardian in which they talk about how GPs are using AI to boost cancer detection rates in England by 8%. And they use C-Design. They talk about C-Design as a tool being used there. So really has been a very, very, very successful technology. So going very quickly through, an example of the problem statement from C-Designs is that you will have the users who are GPs in primary care network, right? So you would say, I am a GP in a primary healthcare network in England who is trying to catch early stage signs of cancer because it's difficult just to get it, just with a bare eye or with the current technologies. So I need help to be able to catch early stage signs of cancer and reduce late diagnosis. But I don't have specialist knowledge. I am just a GP. I don't know how cancer, how skin cancer looks like. If I see a mammograph, for instance, I'm not very sure about, what are the signs of early stage cancer, breast cancer. Um, and maybe, the root cause of the problem is because referral guidelines are not linked to symptoms. Patients come here with symptoms when I see them as a GP. And when we refer them and they have access, when we refer patients and they manage to get access to an expert oncologist, it is already too far down the line. And we're talking about the NHS that has a lot of pressure, the NHS that has a lot of, it access, being able to be referred to specialist takes ages. So if you're a patient with early stages of cancer, it might be, or there's a risk that the cancer ends up progressing for longer when you probably had an opportunity to have a certain type of treatment quite early, but it might continue to evolve until you get access to an oncologist. So how do we do that? And how do we support the questions from these GPs, or how do we get support right at the start? Because we're the first point of contact before they go to a specialist. And of course, the negative effects is if we don't have a solution, patients, with cancer, we might not be able to spot them at an early stage, and we may end up intervening when it's quite late. So the survival rates get reduced. But I'm a GP, right? Like this from the point of the point of view of the user. So I'm a GP. I'm not the person buying it. The person that you need to convince that this is what they need and that this is what will work would be at the end the clinical leads in the primary care networks. They have targets that they need to aim in order to, like KPIs, let's say, to target or to identify early stage cancers. They need to reduce costs, significantly reduce costs. They may not have, cancer diagnosis performance in real time or targets. And the existing solutions might be ineffective. So as a care provider, you may struggle to actually be able to offer something to help patients to identify cancer early. And of course, if we don't achieve our targets, if we don't achieve our goal, if we perform poorly, if our survival rates drop and we get more people progressing to later stages of cancer, then we may have a reduce of funding. So we might be impacted by that, and it will impact our overall performance from our primary care network. Just by putting them side by side, I would ask you questions, if we were in a class, but I hope that you can see how different both perspectives of what the solution is needed, how both perspectives are, they're so different because their needs are completely different. What is quite interesting about C Designs is that they are aware of this. And actually, when you go to their websites and you see how they're targeting their market, even just there, by looking at the title of the website, it says built by doctors for doctors. So they know that although this is a solution that has a benefit to patients, what they're targeting is it's the clinicians and the clinical leads for their solution. Right. I wanted to go very quickly through a process in which you could test the problem statement framework, where you can identify the possible problem and draft a problem statement. But I'm looking at the time, and I'm not sure if we have a lot of time. So what I would like to do is I would like to hand over to Lauren. So I think she has a couple of things more to introduce you. And if we think we have time, I can come back to the framework and we can run the activity quickly, but I would like to prioritize questions with you. Yeah. Lauren,
Okay,
over to you.
brilliant. Thank you so much, Clara. I have a couple of slides actually to share. Would I be able to share my screen? Great. Sorry, it always takes a little second, doesn't it? Here we go. Can you see that?
Yep. Yeah.
Perfect. Okay, so just from my side of things then, just a couple of key pieces of information and dates. So many people on this call may already have an offer and are considering their options, or you may still be at the start of your decision-making journey. So just as a reminder, our applications close if for those who require a visa on the 27th of June. So in 3 days, so not long at all. And if you don't require a visa on the 29th of August, if you do have your offer, you have 5 weeks from that offer to accept your offer. And our scholarship application deadline is on the 29th of June. So again, 5 days time. You do need to have accepted your offer and paid your deposit to apply for a scholarship, but we would really encourage it. We have specific scholarships for our master's courses at GBSH, which is quite unusual, and we would like you to take full opportunity to apply for those. We've got our Global Healthcare Leaders Scholarship and our Women Healthcare Leaders Scholarship. All the information about how to apply and the entry requirements for those is on our website, but I'll also share the link in the chat in just a second. And then finally, if you would like to book a one-to-one 15-minute online appointment with Clara, or potentially a different program lead if you're considering your options still, or just like to have a chat, then her diary is open. You are able to do that. You can either scan that QR code on the screen now, or again, I will share the link to that in just a second. Once I've stopped sharing my screen, I'll put all the links in the chat. It's a great opportunity to, get that one-on-one conversation going and to really ask those questions. Speaking of asking questions, you're very welcome to ask questions right now. The Q&A box is open, just at the bottom of your screen. Do you have any questions about anything? Please type them in and we will address them. And then finally, just to say, your best way to keep in touch, to find out everything that's going on in the Global Business School for Health, is to follow us on social media, and particularly LinkedIn. There's so much going on. We're announcing scholarships, we're announcing partnerships. Our staff are attending conferences and events. Our UCL wider news is on there as well. Everything that you would need to keep up to date with what's going on in a Global Business School for Health is on LinkedIn. So we would encourage you to follow along and engage with us. That's it in terms of my slides. I'll stop sharing now, and I will just post those links in the chat for you for ease. I'm also just going to post our contact email address. So if you don't have any questions right now, but you think of one afterwards, then please do get in touch. I'm just going to pop it all in one message. So just on the chat now, you've got your link to the scholarships page on the website. You've got the link to the event to book a one-to-one appointment and the contact email address.
Thanks, Lauren. Does anybody have a question or any comments or anything? It could be about the business project, because this session was linked to the business project. So normally what would happen now or earlier in the presentation is that the groups would sit down all together and they would start sharing their ideas, give a little bit more guidance on how do you identify a problem that is relevant to you as a group. So they share and they discuss. And then before the end of the session, they spend quite a bit of time, working on the problem statement. So once they identify a problem together, then they start working on the problem statement. But it takes a couple of weeks before they actually get there. So particularly so for you, potentially, if you were to do the digital health program, I see that because you've already put this in practice in a couple of modules, then by the time you get to a business project, you tend to move much faster on how you're defining and conceiving or identifying that problem and understanding what the root cause of the problem is and how to design a solution for that problem itself. For others, it's the first time that they do this. So, but you're going to work in a mixed group. So you're going to work with other master students from other programs. So it takes probably 2 to 3 weeks for the groups to come up with a problem that they will focus on. So that means that when we start the term in January, we ask you to submit a problem statement. It's the only submission that you have in the term. So you submit a problem statement that needs to be very well defined and very clear, but also drafted for you to be able to move from the problem to solution space. We ask you to submit, I believe it's in mid or late February. So you get about a month and a half to think with your team members, what you want to do. Is it possible to apply to scholarships in the meantime? I would say yes, no, Lauren, that they submit their application for a scholarship while they're waiting.
I think, yes, I mean, I definitely would, and definitely, start that application. It requires an essay, so definitely encourage you to get on with that. If you're waiting for your application assessment, then I would, yes, still submit, just explain in the email when you are submitting that scholarship application. The link that I've just shared in the chat has information as to what needs to be submitted and to where. So if you just explain the situation when you're applying, I think that should be fine.
But I agree, because the deadline is so soon. And if you miss that deadline, then you will not have an opportunity to submit, and you don't know. You may hear just before the deadline, you may have an answer. So I think submit if you can, because that will open your opportunities and your chances, your options for scholarships. Any other questions or thoughts or any comments? Again, it could be about the project, it could be about the modules, the program. You have the program lead here, so it could be anything. Could be whatever I can share about the student experience, but I'm not a student, so that would be a little bit strange. It could be about the research project, anything that it's still a question for you, before joining this. Use this opportunity to ask.
Yeah, it's a great opportunity to get your questions answered.
Yeah.
It's not too
I
many
don't
of us on
think,
this call.
yeah, there are not too many of you, so we can spend time answering your questions. You also don't get this opportunity from a lot of programs, from many universities, to have a chance to actually see what is it like to be in a lecture. Of course, it's not a real lecture room, but to get that opportunity, I think is quite it's an advantage, because it helps you with your own assessment and evaluation of, joining us. I'm biased, obviously, but I think we have I probably mentioned it in the open day, but I think we have a very good program, and our academics are excellent. So you have an opportunity to see a little bit, on what is it like to be in a lecture room with them, which is great. So it's great. It gives you, for you as the student that will make the decision to join us or not, you have a first insight that can help you make that decision on whether to join this program or not. I've uploaded my English language test. How soon till your offer status changes? That is with central admissions, so that is out of our control. I wouldn't be able to tell you specific date, but it usually takes, I think, about a week, maybe a little bit longer, but hopefully you should be able to hear back soon. If you're having issues, drop me and the education team an email. So if you haven't heard, let's say by next week or something, drop me and the education team an email, and we can try to follow up on the site. But that process is completely out of our control. It's not with us.
I'll just share the GBSH admissions email with the attendee as well. So you've got that in case you didn't have it before.
Okay, the next question is, how important do you consider networking in a startup project? So I think it depends a little bit on the project, but or in the we work a little bit academically for this. So even if it's entrepreneurship, we're still in an academic program, right? So there are a few constraints that we have when we operate within an entrepreneurial, mindset and entrepreneurial project. So networking is quite important, and as soon as I know about opportunities, I share with all of the students in the master's program for you to go out, and do things to network and meet people whenever is possible, and to the extent of, budgetary possibilities. I offer opportunities to students to go to a conference or two. So I've been able to offer limited numbers of limited entries to big conferences near London, in London or near London. And they, I once I know the budget, once I know the numbers, I do a first come first serve basis, registration. So I announce it. There is this number of tickets. People register if you're interested, and then we'll make the decision on the distribution of them. Students really value these opportunities because it really gives them a chance to meet more people in the sector, but more importantly, to understand the stakeholders in the sector, whether that is from the perspective of the problem or for the implementation of the solution that you are developing. Academically, that's why I make the difference. It's not a requirement for the digital health startup module because it's quite early in the master's program. So students, you're still turning on your engines. So by the time you have to do a presentation of a digital health startups, you've been 2 months into the program. So the first month is quite stressful, confusing, a lot of workload, moving around buildings, trying to do all of the different activities at UCL beyond your program. By the time the second month arrives, you need to start preparing for your final submissions and assessments and your presentations. So for that module, I don't particularly push or encourage, to go out and do networking for that module. For the business project, you have an academic supervisor, which we call co-lead, and you have an industry mentor. So what we're hoping is that through the relationships, stakeholder management is an important skill to be, that is part of the business project. What we hope is that by you working with the industry mentors, you can expand your networks. Something that I'm trying to change, opening the possibility for students to do primary data collection for the business project, but it's a little bit complicated because of the size of numbers that we have. But what you can do is gather testimonial documentation or testimonial evidence. So that's your opportunity when you connect to the industry mentor to go and say, can you connect me with people that are relevant to this sector? Do you know anyone that I can speak with? That is super encouraged. So, and it is important because it helps you understand the problem better, and it helps you ground your solution into reality. So it almost helps you validate whether your solution is viable and whether your solution is feasible, or whether your solution is desirable. Is this something that is actually needed and wanted by our potential users or our potential customers? It was a long answer, but I think it just depends at which stage of the program and in which module we're talking about. Any other questions?
We could stick around for a few more minutes if there are any final questions coming through.
Anything. How do you get to campus? I don't know if you've visited, if you are near London and you had a chance to visit. We are near the Stratford International or Stratford Station. It's quite a nice area. It's quite new because I'll talk a little bit more about this in the induction, but it was restored as part of the London Olympics 2012. So Stratford is not new. The area has newly been redeveloped. I think it used to be like an industrial part of London, and they redeveloped. So it's quite modern, and in my opinion, it's quite nice. It feels a little bit. Some people don't like it because it loses a little bit of that traditional London spirit. Like if you go to central London, but it's quite lively. There's a lot of things happening, and when you come out from our building, from Marshgate, we are in Queen Elizabeth Park. And there's always something happening there. People skating, people running, people just walking around. If it's sunny, there are families outside. So it feels just really, really, really lively. So it's quite nice. You didn't ask a question, but I offered an answer to, to an imaginary question about campus. Any other questions? Remember that you can also book one-to-ones in the link that Lauren provided. So we can have more personalized chat if you're a little bit shy of asking in this forum. There is an induction week. I don't know if you're interested, but I think I'm actually not fully sure about what communications you get, as a student or as a candidate. But we start on the last week of September, so we have activities during that week. Some of them are organized by UCL Central, Careers Fair and all that. I do recommend that you start thinking about your career quite early. because opportunities may come as you're studying and the workload gets heavy. So you get, this is a demanding master's degree, so you're going to be working. So it's good that you start preparing early. But we have other activities, during that week. So we have a session just for THC, so you'll be able to meet other classmates. So it's good. Yeah, that's true. I can see in the Q&A a comment that it's a nice area with a slower life and stunning natural sceneries. If you like running, it's a really nice area too. So I like running and just very close to campus. If you go a little bit, I would say a little bit up north, you get to the Hackney Marshes and it's just green. And you actually don't feel that much in London, but then you loop around and you're in Hackney, which has really cool places and restaurants and really nice places to hang out. So I really like the area where we are, where the campus is. This is not the central campus. Again, if you are familiar with London, if you're familiar with UCL, our main campus is in central London. So it's in an area called Bloomsbury near Euston Station. Or if you visited London, we can say kind of behind the British Museum, like kind of few streets, but but kind of in that area, kind of where you find the British Museum, a little bit behind it. But that's a really nice area too. It's a little bit more of that older London, but also nice. And you have a lot of UCL spaces around. The university facilities are very nice, and you're close to a lot of things. London things, but Stratford is also really, really, really nice. And you can take the Elizabeth line if you walk to Tottenham Court Road, or you can take the fast train from St Pancras for a very short distance, very short walk from Bloomsbury to St Pancras and just take the fast train, or you can take the tube and do a couple of connections to get to Stratford. In general, it's not a big, it's not a big trip between one campus and the other. And the building where we are based is the first building that UCL has built in the east, so that's going to be a bigger campus, in the next few years. So there's that building and the student accommodation that is just across the canal. But there are going to be other buildings in the area as as the university grows more on that side. For us as DHE, we have everything in Stratford. So if you're thinking now about where to live or what options, what accommodation options you have. Of course, you have the student accommodation as an option, check if there's any availability, any spaces. But otherwise, if you have an option and flexibility, I do think somewhere maybe in the east might be quite handy. I don't know, I don't live in London, so I have very long commute, but maybe somewhere there might be handy for you. It's up to you really. But at least you know where the campus is and it's well connected. Okay, so do we have more proportions of lectures in the East Campus or in someone? You have everything in the East Campus, everything. We do a GBSH, we make like efforts to try to ensure that students don't have to move too much between campuses because it has happened in the past, and in general students don't they prefer to have all the lectures in one place than moving between both campus because it's not a bad commute. I've done it, it's fine. But I think when you're quite stressed and you have workloads and you have to, on top of that, do that train ride, I think doesn't students don't particularly enjoy that. So we do all of our efforts to stay within UCL East. For the HE, I can confirm that as of today, with the current timetable, the timetable is still being reviewed, but with the current timetable, all of our lecture rooms, all of our seminar rooms are in the East, all of them. So that's an important consideration. And last year, in term one, full-time students were attending lectures 4 days in a week. This year, we have limited spaces, obviously, because we only have one building. And we're not the only master's program. GBSH has 4 other master's programs. Then we have MBA, and we have a bachelor's degree coming up, starting in September. Plus, there are other departments with their programs in the same building. So we're always trying to accommodate, find spaces for us to make sure that we have the capacity for all of our students. So that said, we're a little bit limited on how we move or how we place our lectures and our seminars. We're limited by the options. But I'm trying my best to try to improve the experience from students so that you have 1 or 2 days where you can dedicate to group work or personal individual work. There's a lot of work, group work across the program. That is in part because it's part of what we encourage at GVSH, teamwork and collaboration. So several of our modules encourage group work. So you may need to consider that as well, when you're thinking about your different moves from campus and here. Obviously, you don't need to meet in person all the time, but in-person meetings make experience a little bit richer, a little bit nicer. But you can meet online if if you need to. Yeah.
I think, shall we wrap it up now?
Yeah.
We're almost
Great.
at the end of our allotted time. And if there's no further questions, thank you to those who did ask some questions today. Thank you to you, Clara, for your lecture.
Thank you.
And thank you for everyone for attending. If you do think of any more questions after this call, then yes, please email contact@gbsh@ucl.ac.uk, and we'll be happy to answer those for you. And we'd like to wish everyone a lovely rest of the day. Thank you so much.
Thank you so much. Have a nice day,
Bye.
everyone.